Vertigo Unveiled. Discover the types, causes, and effective treatments for this dizzying condition. Watch the video now to learn how to manage and overcome vertigo. Vertigo is considered to be a complicated disease. Vertigo means spinning or revolving. This name has been derived from Latin. The severity of this disease is that the person will always feel that they are moving even while standing still. So the affected people always feel to be moving. The balance of the body posture when walking and standing is maintained by the interior part of the ear. This inner part of the ear is very much important for humans and mammals. The balance of the body is maintained by the vestibular component of the inner ear. The other effects of vertigo is vomiting and nausea. The person who are affected by vertigo will have problem when walking and also standing. The major reason for vertigo is considered to be benign paroxysmal position vertigo and vestibular headache. We shall see them here. Benign paroxysmal positional vertigo. Labyrinth is situated in the interior part of the ear. In labyrinth, the crystals of calcium is present. They do not move and these crystals are in fixed position. The basic place for these crystals is in utricle. But, with the affected person the crystal gets dislocated and moves to semicircular canals. The posterior canal is said to be very much affected in this situation. Dizziness, vertigo, changes visual, feeling weak and nausea are considered to be the symptoms. One more symptom of benign paroxysmal positional vertigo is that the eyes revolve towards direction of defected ear. This depicts the situation of the affected person. As the fluid in the interior part of the ear is dislocated, it is also called as canlithiasis. Vestibular migraine is also the major reason for the cause of vertigo. Vertigo itself forms to be a reason here. Therefore, here the main problem is migraine and not vertigo. But the affected person feels that they are affected with vertigo. The severe thing here is the magnitude of vertigo due to migraine. This has been confirmed by a latest research done by experts. Persons who are not diagnosed of vertigo has 2.5 times more chance of getting migraine. Vestibular neuritis and many errors are considered to be other causes. Dizziness also accompanies them when there is a migraine attack. When someone consumes very high level of alcohol, they might get the short-term effect of vertigo. Types of vertigo. Normally, vertigos are classified by the parts they affect. There are two known types of vertigo. The two different kinds are peripheral vertigo and central vertigo. Peripheral pathway. This is also known as vestibular system. Peripheral type of vertigo is a kind that affects the working of the inner part of the ear. Benign paroxysmal positional dysfunction is considered to be the regular reason for this kind of vertigo. Superior canal dehiscence syndrome, labyrinths and visual vertigo are considered to be the other reasons. When the interior part of the ear is affected with bacteria due to cold and cough, then this may also cause vertigo. When there is an injury to skull that affects the inner ear, then it can also result in vertigo. Central vertigo. Whereas, central vertigo is linked with a neurological system of our body. This occurs due to the damage in the brain and not due to the problem with inner ear. The effects of central vertigo are non-clear speech, uncontrollable movement of eyes, speech with less sound. Normally central vertigo is not that severe as it do not involves the inner part of the ear. Heavy sweating, not able to walk steady and excessive vomiting are due to the result of vertigo. When vertigo is not given due care with treatment, it may lead to irreparable damage to the nervous system of our body. Many people are unaware of a good vertigo cure. Vertigo is the feeling of moving when you are still and is usually referred to as dizziness. It is estimated that more than 5 million people in the USA suffer from this problem every year. Dizziness is one of the top reasons people visit a medical practitioner. Statistics show that 5% of Americans say they have an issue with dizziness and balance that is chronic, longer than 3 months. For an issue that affects so many individuals, what is the most effective vertigo cure? It is very important to understand that there are a whole range of things that can cause vertigo or dizziness. Some causes of vertigo are serious and require immediate medical attention. Such conditions may be a stroke or tumor. But for a majority of individuals, the cause of their vertigo is not a life-threatening condition. Even so, suffering from vertigo does impact on the quality of life and make day-to-day living slightly uncomfortable. This video will cover some solutions for different types of vertigo and a vertigo cure for most common cause of vertigo. For some people, what they eat can play a role in their suffering of vertigo or dizziness. The main dietary issues are usually alcohol, caffeine, and tobacco, which can influence the feelings of vertigo. To see if these foods are contributing to your dizziness, try eliminating them for a 2-week period and re-evaluate how you feel with regards to your vertigo. For a few people, excessive salt intake can also aggravate their balance problems. One of the most common causes of being lightheaded or dizzy is dehydration. You can easily correct this by reducing the consumption of soft drinks and having a water bottle handy that you can regularly drink from. A very common cause of vertigo is termed BPPV, or benign paroxysmal positional vertigo. This may sound complicated, but it is basically dizziness that is not caused by anything life-threatening. It is spontaneous in nature, often related to head position, and it is not constant. The cause of BPPV are small loose particles in the inner ear that affect the balance receptors and result in the feeling of vertigo. It is sad that BPPV is often treated using drugs, which only address the symptoms but do nothing to correct the true cause of the problem. Fortunately, there are very effective and safe methods to treat BPPV. The technique does not require drugs or surgery and is backed by medical research. The onset of the vertigo with BPPV is related to movements of the head, such as turning over in bed, bending forwards, looking at the sky, and turning sideways. The vertigo episodes are short and last less than 10 seconds and are described as feeling the room spin or move around them. If you are suffering from BPPV or benign positional vertigo, then something can easily be done to cure your vertigo and get rid of your symptoms once and for all. The use of medication may reduce the symptoms of vertigo or dizziness, but it does so by suppressing the activity of the nervous system. Do not settle for just masking your symptoms when real help is available and can be done easily and quickly in the comfort of your own home. If done correctly, benign positional vertigo exercises are a useful remedy for vertigo. Vertigo is one of the most common medical conditions to affect individuals. It is among the top 3 reasons why people seek medical advice. Vertigo is often mistaken for a fear of heights. It is not a fear of heights. It is also commonly confused with feeling lightheaded, like you are going to pass out. Although the sensations can be somewhat similar, they are distinctly different. It can more easily be described as dizziness. Vertigo is defined as you feeling that you or your environment is moving when they are in fact not moving. It is the illusion of movement. There can be many causes of vertigo. The most common cause is called benign positional vertigo, BPPV. Other causes include vestibular neuritis, Meniere's disease, and vestibular migraine. Vestibular neuritis is inflammation of a nerve that plays a role in communicating balance to the brain. Meniere's disease is a problem with fluid in the inner ear. It has many other symptoms and is very characteristic in the presentation of vertigo. Vestibular migraine is vertigo that is related to a migraine. There are many different treatments for these different types of vertigo, but for benign positional vertigo, it is best treated by benign positional vertigo exercises. BPPV is caused by small loose particles in the fluid of the balance organs of the inner ear. The loose particles affect the balance receptors, which in turn send aberrant signals to the brain. This results in the perception of movement without any movement actually occurring. Often poorly treated with drugs, benign positional vertigo exercises is most easily corrected with benign positional vertigo exercises when they are taught properly. BPPV has very distinct characteristics. The episodes of vertigo are brief and in general last under 10 seconds. It will feel like the room is moving around you. Nausea may or may not be present. The triggers of this type of vertigo are very predictable and include movements such as sitting up or lying down in bed, rolling over in bed, bending over like you are tying your shoelaces, and looking upwards. Masking the symptoms and providing a false sense of relief is often done with drugs, despite the fact that a safer non-drug option exists with benign positional vertigo exercises. Drugs are commonly given for the symptoms of BPPV. They provide a false sense of relief by desensitizing the nervous system and the feeling of nausea and vertigo. They do nothing to fix the cause of the vertigo, they only treat the symptoms. The use of benign positional vertigo exercises is the only way to correct the root cause of this vertigo. When performed properly, they are safe, effective, and quick-acting. Plus, they can be performed in the comfort of your own home. There is a specific way to go about performing vertigo exercises.